Okay, we're back. Good news. Doctor said I can take the tube out. You don't need it anymore. So what I'm going to do is hand hygiene. I've identified my patient. To identifiers, I make sure he's not in any pain and he does not have any allergies. Even though I'm not going to do anything, using anything new, I always want to ask about allergies. Okay. And I'm going to put my gloves on. Again, this is a clean technique. If he was hooked up to the suction, you'd want to turn the suction off, disconnect the suction tube from his NG tube. But he doesn't have any suction on there. All right. I'm going to put this across his chest. I'm going to go ahead and take that off, and I don't need to really take it off the tube. I'm going to give 20 mLs of air. I want to make sure that it's still in place. Because if it wasn't in place, you don't want to be pulling a tube out that's halfway up his esophagus, and then it could get into his trachea. So it's still at 57 where we left it the last time. So I'm going to go ahead and give him a little air to get any fluid that's in the tube out of it. I'm just going to leave that there. Now, notice I'm hanging on to the tube. I'm going to get the tape off. And I don't need to take the tape off the tube. I just need to take the tape off the patient because the tube's coming out. And then when we're ready, I'm going to say 1, 2, 3, and out. And it won't be that hard on a person. It comes right out. And dab his nose, and that's it. That's all there is to it. And then I will document what I did. Now, when we put his tube in, the checklist says to check the lungs and the abdomen. Go ahead and do that for your checkoff. But I'm going to tell you my rationale for not doing it. First of all, I'm not putting a tube in his lungs, and I've discussed this with several instructors, and we can't find any rationale for listening to his lungs before you put a tube in. After a tube is in, if he was choking, then you would take it out anyway, and you would auscultate his lungs. But there's no reason to do it before. As far as assessing his abdomen, if he doesn't have bowel sounds, you would still use an NG tube. Very often they're given for someone that has an ileus, and they won't have any bowel sounds. So do it for the checkoff, but I'm telling you that the rationales really don't warrant it. Because if the doctor's ordered the NG tube either to decompress the stomach or to put meds in or to do a tube feeding, you don't need to worry about bowel sounds. If it's for tube feeding, you would, but if you're just doing it to decompress the stomach, you don't need to worry about bowel sounds, and you don't need to worry about lung sounds. Okay.